Yes, hello everyone. I'll just get my slides up now. I won't be a moment. There we go. Can everybody see that okay? Perfect. Excellent. Well, yes, so hello everyone. Thank you so much for joining us today. So as Helen said, my name's Emma. I'm from Teesside University, and today I want to talk to you about the suicide prevention for people who are arrested or under investigation for sexual offences. And the main focus today is on recognising that suicide risk in this context is exceptionally high and often quite predictable. So therefore, this represents a critical safeguarding issue for the criminal justice systems and beyond. So people arrested or investigated for sexual offences face extremely high suicide risk, particularly in the earliest stages of contact with the criminal justice system. However, what we found was that most research and prevention strategies have historically focused on people who are already convicted and in prison. And what the evidence was showing is that suicide often occurs much earlier, so frequently shortly after arrest or during the investigation phase. So the period where risk is often highest is also the period where formal prevention systems can sometimes be much weak. So this review wanted to focus specifically on the pre-conviction period to identify key risk patterns, look for opportunities for earlier intervention across all areas, so policing, safeguarding, health services, and so on. So one of the most striking findings from the literature is the scale of suicide risk for this group. So as you can see, I've just pulled out some of the key statistics there, because several studies, they've attempted to quantify that risk. So for example, research by Brophy found that around 1 in 24 men under investigation for offences against minors in particular died by suicide, which is very high. Other research suggests that sex-only child sexual abusers, so that is people with no other criminal history other than this offence, die by suicide at around 200 times the general male population rate. Additionally, survey research also shows extremely high levels as well. So this is following investigation awareness, with one study reporting 73% of individuals experiencing suicidal thoughts at that moment. And then lastly, across systematic reviews, estimates suggest that suicide risk for those accused of child sexual abuse or indecent image offences can exceed 100 times that of the general population. So while the exact figures sort of vary across studies, the overall conclusion is quite consistent, that suicide risk in this population is exceptionally elevated. So another really interesting key finding is that the suicide risk wasn't seen to be evenly distributed over time. So instead, it followed a very clear time pattern of crisis trajectory. So the highest acute risk often occurred immediately after disclosure or accusation, sometimes within days of first police contact. And research has also shown that over a quarter of suicides in some investigations occurred within 48 hours of the person becoming aware of that investigation. So this risk can then remain high during prolonged investigative periods. So for example, when people are facing uncertainty around their bail extensions, quite often it was around confiscated devices, because that can take a really long time to happen, or just even long delays in decision making. And then a final smaller point, because we were more focused on the sort of, pre-period, but it does show that it doesn't disappear after the investigation. So it can persist as what some researchers described as an aftershock. So this is where it continues throughout the court proceedings, imprisonment, and even post-release. So what we're seeing is a series of high-risk transition points rather than a single moment of vulnerability. And the literature as well, interestingly, also pointed to several psychological mechanisms that help to explain why suicide risk is so high in this particular context for this particular group of people. So one of the most prominent found was shame and stigma. So particularly the fear of being labelled publicly and the belief that life and family relationships are sort of irreparably damaged in some way. And many people also experience what researchers describe as identity collapse. So there's just this sudden sense that the future has disappeared and that their social identity has just been completely destroyed. Another common mechanism is perceived burdensomeness, where individuals believe their family would be better off without them, basically. But importantly, many of the people who die by suicide in this context appear previously well functioning. So this was interesting too. So these were people often without any prior mental health history. So this is important to know because that means the absence of a sort of psychiatric history should not be treated as a protective factor, because the crisis, what we found, was often driven by situational and social pressures rather than prior mental illness. So there's currently 5 main approaches to prevention, so that this review identified, and that's currently used across the system. So first, police and led approaches. These focus more on procedural safeguards, so things such as structured risk assessments, welfare contact, and better handovers between teams. Second, third sector services, particularly those run by organisations like the Lucy Faithfull Foundation, provide confidential crisis support and space for individuals to sort of seek help without that fear of judgment. Third, there was clinical and therapeutic approaches, and these were often using cognitive behavioural methods to sort of challenge those shame-based beliefs and their hopeless thinking. Fourth, we have safeguard and multi-agency responses, and their main focus was on the wider impact. So that could be the impact that it has on their families, or they tend to emphasise coordinated support across services. And finally, there we have custodial interventions, and these more focus on early screening, monitoring, and mental health support when people enter custody, which is, as we know now, quite a destabilising transition point. So what we found, though, is that each of these approaches plays a role, an important role. But what the evidence was saying is that, and suggested, is that they actually only work really, really well when they're integrated together and across the system, rather than just being used in sort of isolation. So importantly, what this review wanted to do was to see how effective in any way possible that these interventions currently were, and if there was sort of improvements that needed to be made. So despite the existence of guidance, prevention strategies, the evidence repeatedly highlighted gaps between policy and practice. So oversight bodies such as the HMIC FRS and the Independent Office for Police Conduct have documented cases where risk assessments were missed, vulnerability information wasn't shared, or follow-up welfare contact didn't occur. Another sort of place where they fell short was that there was an issue of what some researchers called visible distress bias. So many people experiencing suicidal crisis in this context appeared calm or composed externally, meaning distress was often missed unless staff were actively looking for it in everybody. And then in addition, we had transitions between agencies. So for example, policing, custody and courts were often points where information and responsibility fell through the gaps. So while those frameworks exist, their effectiveness often, what the report found, depended heavily on resources, training for staff, and also a big one, the organisational culture and how they've always dealt with it. So what this review wanted to do was to give out some recommendations about how we can improve what what is out there at the moment. And we came up with 5 key recommendations. So firstly, it was the use of mandatory needs-based assessments at key investigative stages, so such as arrest, release from custody, bail decisions, and major events that happen throughout the investigation. So a point I want to make here is that even though I know I've talked a lot about risk, we've deliberately shifted away from that traditional suicide risk assessment. And the reason we've done that is because recent research consistently shows that risk assessment tools are simply not reliable predictors of suicide, and especially within this population. So they often produce large numbers of false positives, false negatives, and they can create a false sense of reassurance when someone is categorized as low risk. The second recommendation was ensuring consistent welfare contact, even where individuals do not appear outwardly distressed. So it's always, even just them having this sort of being investigated for this offence is enough to just dig a little bit deeper. Third, standardising referral pathways to third sector support services so that individuals are proactively signposted to help, which would be really, really useful because we know how good they work, like the Lucy Faithfull Foundation. Fourth, improving clear and compassionate communication, because what the report also found was that uncertainty and poor communication were major drivers of distress for, these people. And then finally, a big recommendation is strengthening the multi-agency coordination. So ensuring that suicide prevention is treated as a shared responsibility across policing, health services, safeguarding systems, and community organisations. So what the review also did, though, was it highlighted several important gaps in the evidence base. And a big finding that, was we found straight away is that most of this research exclusively focuses on adult white men, particularly those investigated for child-related offences. So this means we know far less about suicide risk amongst women, adolescents, neurodivergent individuals, minoritized communities. So that is definitely an area where we need much more research to guide us. We've also suggested that future research should also focus on evaluating interventions at earlier stages of the investigative process. So this is where we could examine how factors like communication practices, investigative timelines, and safeguarding responses sort of influence that suicide risk. And lastly, longitudinal research would be really beneficial because, again, there's nothing like that out there. And this is where it follows people across the sort of transitions across the criminal justice. So we can actually identify where prevention efforts could have the greatest impact for people. So to conclude, the evidence shows that suicide risk for people arrested or investigated for sexual offences is exceptionally high, it's predictable, and it's concentrated at very identifiable stages. Many of the people who die by suicide in this context had no prior mental health history. So this sort of shows that this is often a situational crisis rather than a mental health condition. So for this reason, suicide in this context should be understood as a sort of preventable safeguarding rather than a sort of inevitable outcome. And preventing these deaths requires a shift from being reactive, diagnosis-led approaches and be more continuous, needs-based safeguarding across the whole journey that they're on. And I suppose ultimately suicide prevention in this context, it should be understood as a system-wide responsibility. So shared across policing, custody, courts, health services, community organisations, and so on. Thank you so much for listening, and I'm very happy to take any questions.
Okay, and Helen, I think you stopped recording.
There you go.
Yeah.